And we're incredibly lucky to have Nadia here today, who's one of the co-chairs of Green at Barts Health. He's going to talk to us today about how we can engage our staff groups and our patient groups. Thank you, Nadia.
Thank you for that very generous introduction. And also, I'm the ex-co-chair now. So I'm kind of here on behalf of the group as an ambassador for them and to talk about the work that happened when I was there. But the group is ongoing now and doing lovely work. So it's really nice to come off the back of the last talk, which has touched on some of the things that I was going to bring in. And also just, I think, for me, why it's so important to get clinicians involved and how difficult it can be, because obviously with the NHS as it is, and also kind of this idea around your patient focus of the patient who's in front of you, that it can be quite challenging to carve out some time and some kind of importance for doing this. I just wanted to get a rough idea of how many clinicians and how many kind of the other types of people I'm talking to, so that I kind of know where to put my emphasis. Could the clinicians stand up? I just thought maybe a bit of movement would help you. Okay, cool. And then the other, I haven't had a chance to really kind of go through the delegate list, but are people from sort of small and large tech organizations, small and large kind of businesses? I didn't give you a chance to stand up, I know. And any other groups that I haven't thought of? Okay, good. So this is somewhat of clinician focused, but I'll try and make it a bit more relevant and leave some time for questions, and maybe at the panel as well. I'm Nadia. I'm a paediatric emergency medicine doctor, still in training, and I was the ex-co-chair of Green at Barts. I was the co-chair of Green at Barts. So I just wanted to start a little bit with my story, and why I got involved, and also kind of what's in it for us. I think, beyond being a clinician, what's in it for us about engaging with the climate challenges. And then I was going to give you an example of Green at Barts, and that's really around kind of large-scale change and climate leadership in whatever area you're in. And then a small departmental example of a Green ED project, a Green Emergency Department project, which is a sustainable quality improvement project, just to show how you can get measurable outcomes and feel like you're making some impact and having some things to show at the end of the day. But a lot of this work is also kind of behind the scenes about changing attitudes and empowering people. So I guess the first thing I wanted to say was that I did ignore the climate crisis for a long time, and I think that's probably like pretty normal because it was quite scary and stressful, and it brings up quite a lot of difficult feelings, anxiety, depression, or just kind of, I just ignore it. And especially when you're working and you've got loads of other priorities, like those difficult feelings are really easier to just ignore. But it gets to a point where ignoring them is more effort than not ignoring them. And I think also I'm a pediatrician, so there was all this amazing work. So like the school strikes happened, and this is outside my hospital, of some of the kids outside the local mosque on school strikes day, raising the issue of climate, and some doctors who are out campaigning, and also Greta Thunberg. And it just became so much in the news, and young people really asking us to do something and address this change. So as an adult and as a clinician working for children's health, I felt that it was, finally I could not continue with my, previous approach. And so that was kind of me doing all my training and just exhausted junior doctor, going do the rounds. And then, so I finally got out on the street and I found a little bit of a community. And also I just wanted to kind of cite my children as a motivating factor. And I think all of us who have families, have children, work in health, and can, have really strong values around wanting to make things better, wanting to protect and honour kind of the responsibility of what we've been given, and try and make things better. So that all kind of came home quite hard for me. And so I was really motivated. And I think those are really, for many people, certainly in healthcare, but people who, are trying to make the world a better place overall, I think that core value is really a really good motivating factor for then doing your counting and making, thinking about your carbon budgets and things like that. But I think those core values are really the main reason that people do get involved, and they're really powerful values to try and appeal to. So these are boring slides, so sorry for that. But basically, I just wanted to talk about the good, sort of, for clinicians especially, good leadership is definitely shown to improve outcomes. And I think when you're thinking about climate and leading with values, you can easily see how, if you talk the talk and walk the walk, you're going to be a more credible leader. And that will help in all the aspects of your work. So I think it's fine to kind of be quite clear and quite open about your values and encourage the people you're working with to kind of always have those as a motivating factor. So my values and kind of why I entered healthcare were, I guess, these aren't the things you think about, I think, every day, of course, because you're just busy doing the work, but making meaningful change, and I think as human beings, we're all really motivated to do that. And for me, to be a force for good, and kind of respect and honor this place and this planet, and because of my job as a pediatrician to kind of, and a parent now, to sort of protect and advocate for children and young people, and make decisions with them in mind. So they're the ones who are going to inherit this system and this place and this earth and this city, whatever it is, trying to think of decision making with children in mind and putting children and our kind of future generations first, or at least having them in mind. And I think when designing services for adults, often children's needs do get ignored, and often budgeting for children's services gets ignored. So it's kind of similar to that, I suppose. But and I guess I think it's just kind of empowering everyone in the room to feel like you have a role as a kind of a responsible elder for the society that you live in, and kind of just feel really kind of. And I wanted to give a minute, really, just to maybe if you could all just have a moment just to kind of think about your core values and what motivates you to bother, really. Have a minute. Don't check your phones. Just, what really motivates, what you really care about, what you think is important. And I was just to tell you that working with your values, kind of aligned with your values, is really good for your mental health. So it will just make you feel better. It will make you feel good. And that's how you get people to do stuff like counting the carbon and other going through the bins and checking the waste, because the feeling that they're doing something good, it makes them feel good. So that's the really key thing, as well as obviously there's other benefits. You're going to save money and you're going to save on waste and things like that. And this is the Green at Barts team. And I think the key thing about Green at Barts was just, I have to cite our leaders, which was Flo Wedmore and Tim Martin, who have now left, but it was their idea, and they were just pretty loud and talkative and just talked about it, and went around to all the different people, and then got this group together, and then the group just gradually grew and grew and grew through networking and just through kind of talking about, we really want to do something, this isn't good enough, we want to make a change, but how can we do it? And so the network was born, and this is some of the team. So we did lots of events, and we did so networking with the quality improvement team, and just finding out all the people in the hospital who could empower change and who cared and who wanted to make a change. And then it became really easy because you have a big group, and the work is shared because there's a lot of work. So then, when we asked people why they joined the group, and this was by the time this group was about 200, 250 people, we asked them, why did you join the group? Or what do you get out of being in this group? Because obviously there's a WhatsApp group and it's kind of extra work for you potentially. And these are the things that they said. And these are really powerful, motivating feelings. And I think, I'm not from a corporate background, but I think these are really motivating. If you can get your team to feel like this about a project and about a group, they're going to be very, very dedicated to that group. And for clinicians in the NHS, it's very protective against burnout. So feeling for belonging and inclusion and things are proven and evidence-based ways of protecting your clinicians from burnout. So, yes. So then moving on, the talk is kind of about leadership for change, and then a little bit about the project specifically. So I'll probably move on to the project specifically, but I think the key thing was just to say, if you wanted to start such a network like Green at Barts at your trust, then there's a kind of process to go by. I'm really happy to talk to anyone about it, and the Centre for Sustainable Healthcare has great resources as well, but you want to just basically talk about it and then start doing things and gather people around you. And there's a kind of process, and the sustainability team within the hospital are paid professionals to kind of do that, so they will help you. And then just thinking finally about kind of what can we do to make changes. So there's different spheres of influence, and there's personal. So in terms of maybe flying less or not flying at all and things like that you can do to address the climate change and reduce the carbon footprint. But also there's professional things and political as well, more kind of small p political. And what I'm talking about is for all of us really to use our voice in whatever area we are in. And I guess for the healthcare workers in the room, it was just to kind of share this gift with you. My slide. Share this gift with you that you're one of the most trusted professionals. This is an Ipsos Murray survey that showed, who are the most trusted professionals in society by kind of employment and education. And the top ones are the nurses, so you're in the best position to go out and speak truth to power on, issues that you think are really important and to share it with the public. But doctors are second, so we're also pretty good. And that's a real gift, and that's something that if we're not using, it's a real shame. So then moving on to my own the specific project. So Green at Barts was the kind of big overarching project, which was, as I spoke about. And then within that, I wanted to do something local in my department, and just following up from the previous speaker around sustainable quality improvement and how you can actually get measurable outcomes within a time frame in your department. So I looked at the Green ED, the Green Emergency Department framework, which the Royal College of Emergency Medicine has developed, which is a really helpful framework, and there's lots of other things that the Royal Colleges have done, but that was quite nice. And I think around doing this kind of work, you can always, you've got your measurable outcomes through sustainable quality improvement methodology. You're always going to get some really great team building around this kind of shared values and shared kind of project that you're working on to deliver. And then through that as well, it's an excuse to talk about the staff and train people and get them educated. So those are kind of the other benefits. And that's the model, the Centre for Sustainable Healthcare's model that was mentioned previously, so I won't go into that. And then, so what we did was, just find my slide, was launch the project. We got some, one of the team in Green at Barts was able to launch reusable surgical masks. We were one of the first places to do it. And not the first, but very early on. And just again, start talking about the things and come up with some infographics of like carbon hotspots in the department that people could tackle or get to give them ideas about what they could do. And so also part of that was around education. So for me, I'm a paediatric A&E doctor. So all day long I see children with respiratory exacerbations, so mainly asthma or pneumonias or things like that, all day long, coming into A&E, especially through the winter, or especially on highly polluted days with very bad air pollution. And, they'll come in, they'll create some carbon by journeying in. And I think, Johnny, you may have spoken on where our carbon hot spots are in healthcare, but they'll come in either by ambulance, or which are all diesel. There's some electric ambulances now, but mainly still diesel, or they'll come in by bus or by car. That will produce a bit of carbon footprint and reduce the air quality. Then they will be treated by me. I'll probably give them an asthma inhaler, and that's got quite a high carbon footprint. So we'll pump them full of salbutamol, and that's your inhaled gases and all the kind of medicines of the supply chain. And then I'll kick them out and just, then see the next patient. And wouldn't it be amazing if we just reduced the air pollution? Or wouldn't it be great if we could switch those inhalers? Wouldn't it be really nice to do something that was more kind of around prevention and being kind of smart about things rather than always firefighting? And I think as an A&E doctor, that's what we do all day. But you also then think, I should think more widely. And I think that's also very motivating for clinicians. Like, wouldn't it be really nice to do something upstream? And I think we do get tired, and I think it's very motivating for us to do those kinds of things. In the Green Emergency Department project, this was the driver diagram, and it's pretty busy. You can't really read it all, but it had loads of change ideas. And I guess it was just to emphasize that this kind of stuff wasn't really possible without the Green at Barts network to kind of back us up. It's big work, and it takes a lot of, it takes the full team, but your hospitals are really so well resourced. We've got business intelligence, we've got quality improvement, and people do care, actually. So, they can help you. And this was just about the stakeholders. There were loads and loads of different stakeholders, and hopefully, potentially that can be people, external agencies outside of the NHS, and I think that's somewhere where I would like to learn and kind of develop more of partnership working to take advantage of things. Because we're not always aware of those. But within the hospital, we have our sustainability teams, all the leadership in the hospital, and the business intelligence unit, and your pharmacists. and they're great networks. And so this was the end of the project. We just sort of celebrated the success of some of the things that we'd achieved. So we showed a poster at the Royal College of Paediatrics National Conference, because there's quite a lot of interest from doctors and for this work. And these were some of the actual outcomes. So we were able to change all our patient information leaflets from paper leaflets to a QR code poster, and that reduced our carbon footprint. We did some training for A&E doctors about how to talk to parents who brought in their wheezy child about air pollution and what they might do to reduce exposure to air pollution, because that, and then we got some money in, we got some successful funding from the Green NHS team to do some work with reducing, bringing patients into hospitals, so just like around that sustainable care model that they could be treated at home using telemedicine, which wasn't a model available for A&E previously, so that was quite exciting. That's 15 minutes, and I wanted to leave time for some questions. Okay, perfect. So just to talk in a bit more detail about, this was about the air pollution work we did. So there'd been, these reports to doctors about, doctors or healthcare professionals about the first death that had been attributed to air pollution as a secondary cause was air pollution. And that was really, really groundbreaking. A few years before that, a really great report had come out about the impact of air pollution on children and adults' health, not just respiratory. But despite that, nothing had changed. Nothing was really in the curriculum. We didn't know, like, what should I do as a doctor about that? So we developed this simulation training, and we of a parent coming in and saying, is there anything I could do to help support my child's breathing, or to, and it was just about empowering doctors and giving basic education. There's resources available from the Global Action Plan, and there's lots of NGOs as well, I think, doing work around this, and it was just about empowering doctors to just have those conversations and feel that they can be agents for change, and then feel that they can, as with smoking cessation previously, when we wouldn't want to tell people to stop smoking or kind of highlight that, that's not a big deal now at all. So we did that work to empower clinicians. This is about the QR codes leaflets, and this had some measurable outcomes. The cost savings were modest, but it's nice to have a number. So we had this triple bottom line idea of a kind of social benefit, which was that it's actually easier for patients. They get a straight, use their camera to access the QR code. And at the Royal London, where I was working, there's a lot of non-English speaking or second language English speaking, so you could offer it in any language instantly through Google Translate. So no extra work for us, and just a better service for most patients. And the cost saving was about £110 a year, and we got some carbon saving too. So that's the sort of triple bottom line around improving for patients and cost saving and carbon saving, better for the planet. This is about REACH, which is the service that we got £15,000 of funding from Green NHS to kind of promote, which is about being able to let the ambulance service would go out to the patients at home and consult with an A&E consultant and say, look, I don't think they really need to come in, but can you give some guidance or help us, or like access a pathway out in the community? And these things are already available. It's just that there wasn't really that kind of organisation and network and system around it. So it was to promote that, and the team won an award for for developing this pathway. And this is just to show that there were lots of unfinished business when I left. There were lots of this is the wish list and the things that we didn't get done. But, it's a kind of work in progress. And then I guess just to highlight that, engaging clinicians and doing the work is kind of around getting some measurable outcomes using quality improvement and thinking about the sustainability of the work. So making sure your key influencers and leaders are involved at least verbally, and that you can hand the work over to someone when you leave if you're moving around. And that the really hidden additional benefit is always around teamwork and making your teams work better together, and around that kind of ideas of shared values. So thanks a lot.